Oh man, oh man. So, in this video, I am going to give you my honest thoughts about decompression, spinal decompression. This is sort of all the rage. Well, I thought it was going away, but apparently it's back. And so I'm seeing all kinds of stuff. People trying decompression, people trying to do all kinds of different things to obviously resolve their pain in the back, butt, and or leg. So I want to give my thoughts on spinal decompression. And this is inspired, of course, by an actual comment and or message that I got from someone online, because that's where I help people, online. Right, and so let me read it to you, and in this video, hopefully I can just give you some honest thoughts. Of course, some of it's just going to be opinions, but you can take that for whatever it is, all right? And I also want to tie in some of the evidence as well, and help you think through whether or not spinal decompression is something that you should do, shouldn't do, and sort of what my thoughts are on it, okay? So hopefully this helps you out. All right, so to kick things off, let me just read this to you. I got a message from a person today who just started decompression. By the way, this person has had a lot of trouble sleeping, all right? So that was their big issue in the back, butt, legs, so like sciatica type stuff. Hey, Charlie, just had my first decompression today, 19 to go. It went well. I'm looking forward to the next one, Monday. I have 4 next week. The physio said most people feel a difference on session 15, so we'll see. If I respond, I plan to have another 20 on the second disc. Thanks for asking. Keep you posted. Also, he's gone through some exercise with me to try alongside the decompression therapy. So first things first, this is a prime example of a treatment addressing the symptoms, not the cause. So this person has trouble sleeping, right? And they have symptoms of some type of back, butt, piriformis sciatica problem. But the decompression is treating the pain, the symptoms. But what's going to happen is, because decompression is a machine and a person has to go to the clinic, get on it, pay a lot of money for it, right, and then get off, they're going to go back into their life, which caused the problem. Decompression didn't cause the problem. It's trying to treat the symptoms to reduce the problem, rather than teaching this person how they can modify their sleep, modify their nighttime routine, improve their overall function, and sort of make changes throughout their day to find comfort. And so the issue becomes is that this treatment is aimed at fixing maybe symptoms and or an issue versus teaching people how to fix themselves. And so even if it does work, the person will go home and they will have no idea how to, unless they want to buy a decompression, a DRX 12, 1900 or 9000 or whatever it's called, machine, unless they want to buy that for themselves, they will go home and have no idea what to do for themselves, all right? So does decompression leave you empowered or disempowered? I would say disempowered. Ding, right? So that's a check against it for me, all right? Now, this person says, first session went well. I'm looking forward to my next one next week. Physio said, most people feel a difference on session 15, so we will see. I don't even know what that means. There is no evidence to suggest that at session 15, it's a person's anecdotal experience. I doubt it comes from any data. Session 15, that's when most people begin to experience a difference. If you have to wait 15 sessions over the course of what, 3, 4, 5 weeks to see a difference, then I suggest you run very quickly in the other way. Now, maybe you can't because you've got a pain in your back, butt, or leg, but if you could, I would go very quickly, all right? And the reason is this. If you see 0% change, notice the we shall see, right? If I respond, the confidence is at an all-time high, as you can sense, right? If you don't see a change immediately after some type of treatment intervention, then we'll call that 0% change, hopefully, just to quantify that for you. You can make sense of that. If you do not see a change after a treatment session, you have 0% change. Then if you do that treatment 15 times and there's 0% change after one, then why all of a sudden at the 15th would you see a difference? 0% times 1, 2, 3, 4, 5, 6, 14, no change. But then somehow 0% change at session 15 becomes the winner? Really funky stuff, all right? Looking at some notes here. So there's even very little to no evidence, at least no conclusive evidence that I'm aware of. If you want to find some, that's okay. Just recognize it's probably biased and or created by the manufacturers of the machines, all right? That lumbar traction and or decompression is any better than doing just exercise and or some other type of treatment that doesn't cost, number one, as much and is more empowering, more something that's in your control. So this is interesting, right? And let me bring up this point. She says, hey, not only am I doing this decompression, but he's also gone through some exercises for me to do alongside this treatment. Well, since decompression is so good at what it does, right? Fixing the discs or doing whatever it does with the discs, right? And it does so by session 15. Then why would you want to do anything else on top of it? If you're so confident that decompression is the solution to your problem, and or if that provider is so confident that decompression is the solution to your issue, then why add a bunch of exercises on top of it? And the truth is because they're lost and because they have no clue what they're doing. And here's the thing, if it works, this person might come back to me and say, see, it works. I can see the comments now. Decompression worked for me. Well, great. But if you did decompression alone, then okay, maybe decompression worked for you. And if that's the case, great. But unless you own a decompression machine on your own, and you go back into your life, it did not teach you, it did not change your knowledge base. You cannot solve your problem using the same knowledge that you used to create it. Really smart person said that, all right? Look it up. I think it was Einstein. Either way, it does not put you in control. It does not teach you what you need to do long term. Maybe short term, yes, but not long term. Now, if in this case, person comes back and says, see, decompression worked. Well, was it decompression or was it the exercises that they gave you on the side? You see, if you do not follow a scientific method and or process for solving this, then you will believe whatever you want to believe. But scientifically, you cannot put the reason as to why you're improving or not improving on any one specific thing, right? So decompression worked. Well, decompression worked, maybe. Or was it the exercises that you were doing? And the reason this is important because the person says, hey, we'll see if after 15 sessions I start to respond. If I respond, scary to say if, I plan to have another 20 on the second disc. So let's just say that you do respond with decompression and exercise combo. Was it the decompression or was it the exercise? Do you need to pay for another 20 sessions of decompression or could you just go and continue the exercises for the second disc? That's another issue. Decompression is non-specific. Yes, it's pulling on your back, but it's pulling on the nerves, it's pulling on the joints, it's pulling on the discs, it's pulling on all kinds of different things. And so I'm not sure how they were able to convince you that this bout of decompression in these first 20 sessions are only going to target the first disc and is not going to pull on anything else. But then the second one is going to be somehow different. It's not going to be. And it's going to target the second disc. Do you see how strange that sounds? And do you see the flaw in the logic? How is it that a decompression machine could pull only on one thing within your body and forget about everything else? It can pull only on the first disc but not the second disc? You've got to challenge these thoughts. They just don't make any sense, all right? This is a prime example, right, of you becoming more indebted to others fixing you rather than you learning how to fix yourself. And again, you can get decompression if you want. I think it's far overrated. It lacks scientific support. It causes you to rely on other people and or, in this case, other things, a machine to fix you, which is probably fairly prohibitive to have at your house space-wise, maybe cost-wise, and just would be weird to feel like in order to survive, you have to jump on a machine every single day when you could learn to fix yourself, right? And so lots of people want to live in offense. They want to jump right to what I call the third phase of sort of healing or solving this problem. So first step in solving problems is you need to optimize the environment mentally and physically so you're not nicking the scab. Sometimes you just don't know what you don't know. Second is like self-assessment. So you're not relying upon other people to assess you. Third is movement as medicine. And forget about even movement. Just think of inputs or doing, okay, as medicine, meaning healing by addition. All right? And so everybody wants to heal by addition, by doing things. Because if you ask me, what's in this message? Hope. We shall see. If I respond, had my first one, 19 to go, it went well, and looking forward to the next one. Do you sense the hope there? The hope in some external source or external factor that you will get better. I don't know about you, but I don't like to rely on other people to solve my own problems and or fix me or do anything for me. Why? because I realize if I rely on somebody else to fix me, then I don't know how to fix myself. And so obviously this is a personal choice. But people want to live on offense. They find hope in the doingness, doing decompression, getting adjustments, buying something online, and or committing to a new doctor who promises that they can fix them, that they can fix you. But the truth is, only you can fix yourself. And so she can go 4 times a week to a machine to pay someone else to have them do this stuff and to her and fix her. Or what if she could find one motion, maybe 2 motions, that instead of 4 times a week, 4 opportunities for success, she could do, let's just say even 4 times a day. So now you take it from 4 opportunities for success, 4 decompression treatments a week, to 4 times a day. So 4 times a week, 4 chances of relief in a week, or 4 times 7, last time I checked, 28. Now let's just say that you find 1 or 2 exercises and you do it 4 times a day, but you do it 10 reps every time. So 10 reps, 10 reps, 10 reps, 10 reps. Now that's 40 inputs a day. I can't even do the math. What? 40 times 7, 280 chances to solve your problem. And more importantly, ability and or opportunities for you to collect feedback and or gather data around what works versus what doesn't work. Because right now, this person's got one thing, one bullet, decompression, and we'll just see if it works. If it didn't work the first time, well, we'll just hope that 0% improvement right now means that I'm going to eventually just get better. One bullet. Instead of looking for the magic bullet, instead of becoming so outcome dependent, I need to get better, I need to get better. If I do this, this will work, and if it doesn't, then it doesn't work. Follow a process. Be willing to be outcome independent, and instead use the journey and the data that you collect. Ideally, you're doing this with some mentorship by someone who teaches you how to solve your own problem. Use the data that you gather, the motions that you test, the knowledge and understanding that you gain about what pain is and what pain isn't, the things that you try throughout your day to change your pain experience. Use this data, which you can gather much quicker than if you have to rely on someone else, by the way. If you have someone teaching you how to collect this data and how to use your own body and your own brain to solve this problem, then you will be in a much better place to more quickly gather data. And the more data you have, the more you can understand, the more clarity that you have, and the quicker you can get to the solution. All right, so again, it's your call at the end of the day. When we look at the science, we don't really have anything to suggest that decompression is better than not. Lays you on your back, right? Pulls on you, doesn't just pull in one area, pulls on multiple areas. And then guess what? Well, you've got to revisit this thing called gravity. So then you stand back up and guess what? Problem comes back. Why? Because nobody taught you what to do about it. So you're reliant upon this machine or whatever to fix you. And a final thought here is that decompression treats the diagnosis and or the pathology, not the person, right? So much of marketing and that which is sort of out there about decompression talks about restoring disc health and restoring disc height and all of this stuff. And so this is in direct opposition to that which New Age medicine, if you want to call it that, is trying to teach people about pain, which is you are not your diagnosis. And there are many people who have disc problems and do not hurt, right? There are some people, of course, who do have disc problems and it hurts. So, but pain is more than just a disc problem, right? Pain is an experience or output from the brain designed to protect you from some perceived and or real threat or danger. And so you can have these problems and feel all the pain in the world, or you could have these pathologies or diagnoses and feel nothing, right? And so if we try to target the diagnosis and the diagnosis only, it further indoctrinates people into this belief that I've got this thing wrong and it needs to get fixed. And the only way that I'm going to get out of pain is if I fix that. And so I don't like that it disempowers people, makes people feel more broken, when in actuality we want to give people the tools, knowledge, and understanding to begin solving their own issues, all right? And so that's a thought. And so that's something I don't like about this idea of decompression as well as the marketing behind it. So those are my thoughts about spinal decompression, right? Happy to answer any questions that you may have, because obviously I'm aware too, this is a little bit biased, right? I am speaking it and these are my sort of thoughts and opinions, but hopefully it makes logical sense to you. And you can see why I might sort of recommend against it. You know, if it worked for you, great. If it worked for you, did it work for you, or did the things that they did along with the decompression work for you? I think that would be something maybe interesting to ask yourself, right? Either way, at the end of the day, we want you to feel better. So let me know your thoughts in the comments. Was this useful? Was this interesting, right? Was this too much of a ramble? Let me know either way. And then hit the like button, hit the subscribe button, as well as the bell for notifications when we go live every single week with content like this to help you guys out. Thanks so much. Chat soon.